Good morning, everyone. I knew the introduction would sound a little bit intimidating, so I brought all my friends with me, so it feels better. I'm going to spend a little bit of time providing a framework for what we're doing, but just in a nutshell, we and many others are trying to create a system to prevent child maltreatment in Los Angeles County. We're working at it through a number of fronts, and I sort of want to frame why that's so important, because a lot of people are not very familiar with the extent of the number of families and children whose lives touch our child welfare system on a regular basis, and why we think preventing ever coming in contact with that system, as well as preventing abuse or subsequent abuse, subsequent reports is so important. So I want to do it through three frames. One is the personal, the individual. The second is the system frame, and the third is the data frame, and we'll come back to those later. The individual, the personal, I'm going to use an example of my family. So why is it that somebody who is a happy academic at USC also spends about half of my time working very actively with county government and a lot of other players in trying to translate knowledge into action? It starts when, well, it probably starts earlier, but the moment for me when it started to crystallize was when I was about 12 years old. I came home from school one day, my mother was distraught. She had finally worked up the courage to go seek counseling for my brother, who was having increasing problems. She came back distraught. She went to the VA, which was the only place she could think of to potentially go. She came back distraught because what the counselor said to her was, "He doesn't have a problem, but you do." And that was so devastating to her in her context of having 3 children, a husband who had just finished his graduate work and was ABD, his first job, ABD, so a little bit distracted, in a brand new state with no friends or family. And it took a lot of courage and strength to reach out. And to get that immediate response of, "It's your problem," meant that she didn't go seek help for him or for herself for at least 10 years after that. Ironically, both of us, my mother and I grew up to be a social worker. She became a social worker later to make sure that other families were greeted when they got up that first courage to go and seek help with a more welcoming attitude and an offer of warm support. So what happened in our family was that my brother subsequently developed full-blown schizophrenia, committed suicide. It was not occurrences that initial counseling would have changed, but what it would have changed is it would have given her support. And it would have meant that all of us in the family had a better sense of what our opportunities really were and how we managed the problems. I can just imagine now, having been a professor of social work training MSWs for 30-some years here, that somebody wrote down in their notes, non-compliant, difficult, refuses to engage, uncommunicative, et cetera. From my point of view as a 12-year-old, she was, and later, she was overwhelmed, frustrated, and unable to figure out which way to turn. So this was a long time ago, as you can tell by how old I am. This was not a time when we had the degree of reporting to the child welfare system that we have now. This was actually at about the time that Kemp and his colleagues were defining the battered child syndrome, and it was about a decade before every state in the country established mandated reporting laws and registries for people, families who have reported allegations of child abuse and neglect. So my family didn't get that kind of referral, but it could have in a different time and place. That is not the only family I keep in mind, obviously, but it's the driver for me of having to be more supportive for families, less oriented to the punishment for families who are doing bad things, and more supportive. So that's the personal. The systems part, and this we're going to hear much more about, is that you may have heard the phrase both child welfare system and the other phrase child protective services system. We use both of those phrases sometimes interchangeably. They actually mean two different things. Child welfare means attending to the child's well-being and the family's well-being. And when we call our current system a child welfare system, we are being extremely generous. Child protection means protecting the safety of the child. And the safety of the child is generally assumed to be at risk because of the parents. So we have most of our attention focused on child safety, some of our attention, some of the time focused on family well-being, family support, and child well-being, but a very uneasy balance between the two. What we're trying to do in Los Angeles County really is right that balance and think about how other players outside of the child protective services system also play a role. We are building coalitions and partnerships based on what already exists to address this issue. Just a couple of pieces of data, but we'll go much more into data later. In one of the first studies that we did at the Children's Data Network was a look at the cumulative risk of being reported to our child protective services system for babies born in Los Angeles County. For babies born in 2006 and 2007, the cumulative risk of being reported with an allegation of child abuse or neglect to our child protection hotline before they entered kindergarten was that 15% of all babies are reported. It varies in different parts of the county, not surprisingly. Our highest rates are in the Antelope Valley, our lowest rates are in the West LA, but it's 15% of all babies born are reported before they're age 5. There has also been some national research on the cumulative risk of coming in contact with the child welfare system. A national estimate that looks at investigations estimates that over a third of all children in the country are investigated. Their families are investigated for child abuse or neglect before they are 18. In Los Angeles County, where we looked at reports, we didn't look at investigations, it's about 27% of all of our children. So what's happened over time is the child protective services system is in place. Its primary responsibility is safety, but all kinds of other problems come to the attention of this system, and there isn't an easy way to figure out how families know about other alternatives before things come to the crisis point of being referred to the system. So as I said, I brought all my friends along with me, both because it makes it more fun and because they know much more than I do. And so I'm going to ask Carrie Milner, who's the Assistant Director of the County Office of Child Protection, to tell us a little bit about that office and what we're trying to do with this prevention work.
Thank you, Jacquelyn. Hi, everyone. I'm Carrie Milner. I'm with the Office of Child Protection and have been since its creation in 2015. We were created by the Board of Supervisors, unfortunately, for very bad reasons. That was because there was a very tragic death of Gabriel Fernandez back in 2013. Many of you may have seen it in the papers. Because of that, it was created a Blue Ribbon Commission, which created a call to action to say, we need to do things better. We need to fix the child welfare system, which is much broader than just the Department of Children and Family Services, but includes all partners, community partners, the court system, other county departments that are serving children and families, and how do we coordinate and bring all of these players and efforts together to do better for our children and families, and make sure that they're not only safe, but as Jacquelyn mentioned, really that families are engaged, that families are given the supports they need within their own communities, and that they know where to go when there are any concerns where they would want some support. And so with that, one of the recommendations in that initial Blue Ribbon Commission report was to create a prevention plan, a county-wide prevention plan for how do you prevent children and families coming to the system, particularly child welfare. But the idea, which I'm sure most of you know better than I do, who have been doing this work for a long time, is that preventing child maltreatment also prevents all other bad outcomes. There's no magic bullet of what you do that prevents children from coming to the child welfare system that's any different than what you're doing to prevent them from going into juvenile justice or having mental health issues or dropping out of school or any other negative outcome. It really comes down to strengthening families, giving them the supports they need, helping them in areas and ways that meet their needs where they are at the time that they need them as early as possible. And so with that, we worked really closely with USC, particularly Jacquelyn, with First 5 LA, bringing partners together to create a county-wide prevention plan, to create a single focus and a strategy for how we were going to work with our families out in our communities. And so what we did is we came up with a plan with 6 key strategies. I'm going to talk about 4 of them, and then Linda and Jacquelyn will talk about 2 of them. One of our initial strategies was this concept that we called networking the networks, which is to say that we know out in LA County there are tons of networks that are trying to help prevent children and families, that are working towards prevention. They're basically agencies who are grouped themselves with other agencies, are working together, are cross-referring. And so our initial thought was, how do we bring these together? We have all these different networks out there, and how do we get them to work together, which strengthens the network across all counties? And so we actually worked to issue a survey, and we got from those survey results 70 different networks that identified themselves across LA County that are working to, in some aspect with children and families in prevention work. And so with that, then we came up with a set of recommendations largely from them in terms of what suggestions did they have around how do we braid these networks together? How do we bring them together? What does that look like? And we came up with a set of recommendations that we now are taking out back to the communities to vet. And so we have created SPA convenings throughout the county. I think we've completed 7 of those at this point.
Service planning areas.
Oh, thank you. Service planning areas.
Not day spas.
Yes. Thank you, Jacquelyn. Yes, and I think there's 7 of the 10 that we wanted, convenings that we wanted to have, including one that we're doing just with parents, to get to see what they think about these recommendations and what resonates for them. And with that, we're going to take those and bring them back to county leaders to say, how do we actually support this work? If we want to support the work of communities, how are we going to support these recommendations in strengthening these networks? And so that's one effort that's underway. The second has to do with one key network that we identified called the Prevention and Aftercare Networks. They currently have a contract with the Department of Children and Family Services to support families up front as early as possible within their communities, and they do some really tremendous work, some very creative work around income stability and just how do you bring folks together. A lot of it's based on protective factors and strengthening families and building social networks and connecting families to their communities and what's happening and so forth. And so with that, we were able to actually, for a 2-year period, thanks to an influx of money from the Department of Mental Health, actually triple the budget of those networks so that they could serve many more families over the next 2 years. And so we're very excited about that. We're trying to figure out how do we grow their networks and link them up to the other networks even more so, because we know that, as many of you folks, say all the time, we've got children living in families, but families are living in communities. And we know that we're not going to make any difference unless we really strengthen communities and support that work moving forward. Another strategy that we had in terms of data had to do with the release of a report called The Portrait of LA County. This was created by Measure of America, which is an organization outrooted in New York, but they've been going around the country, going to different counties, different cities, and creating these pictures of data that run throughout communities and use what's called a Human Development Index, which is a measure that takes economic data, education data, and health data and creates a sort of, if you will, like a healthy number that you can use consistently across all communities to say, where do people stack up, where are the strengths, where are the challenges, and then how do we target resources better to meet the challenges and create more equity across our communities. So that report we released a year ago. It's been out in the communities. Hopefully you've seen it. We've been really working with different partners to say, take this data and then think about how do you target your resources? How do you use this information in your own strategic planning efforts and your own work out in the communities, out in the field, in terms of how we, again, further strengthen communities. And so that work's been happening. We are having a convening at the end of April to talk about what leaders have learned in using this report and using this data going forward, what have been the ways they have been able to plan better or better utilize resources, and using that as a strategy for then and creating recommendations about how do we then move that work forward and make sure we don't lose the momentum that that data has been able to help provide. And then the last area, also in the data realm, is all of this work is great, all of it is wonderful, but if we don't measure it, then did it really happen? So we've been working with our county departments and with some community providers in creating a set of metrics that we can use around two efforts. One, we actually, as Office of Child Protection, are very interested in creating a set of county metrics that we could put up on our open data portal site so everyone could see it, using county data to just show how are we measuring child protection and what does that look like and how do we put that out there. To start with that effort and then attached to this plan, we said, well, let's just start with prevention. What are some metrics and key data we can use that show us how are we doing in terms of prevention? What does that look like? How can we pull that together? And then we want to put that on the open data portal as well. And so we're right now in the plan where we've had a 3-day convening. We pulled all kinds of partners together. We have a draft set of metrics that we are now vetting and hope to then start pulling that data and making that available for everyone, which will hopefully be useful.
So there are 2 universal strategies included in this plan, and neither one of them is firmly rooted in county government. Both of them are things where we have multiple programs, we have different funding streams, we have lots of vendors that provide their services in different parts of the county, but there's no umbrella, really. Early childhood education and home visiting. So Linda Aragon is going to talk about home visiting. I'm going to talk for like 2 minutes about early childhood education because home visiting is really much further along. How many of you are parents? So anybody who is a parent and has tried to find non-familial childcare will have stories about how very difficult that is to do. It is, I'm continually astonished in talking to parents, the kinds of things that they talk about. It is, for many people, the most traumatic system to try to navigate and negotiate because it is so fragmented. So we have money for subsidizing early childhood education that comes from the federal level. That's Head Start or Early Head Start. We have money that comes from, with our welfare system, TANF Child Care, and we have multiple funding streams that flow through the California State Department of Education to localities for early childhood education. What we don't know in the county, we know we have 500 licensed child care providers, probably more, but at least that many. What we don't know is, taken together, how much money comes to LA County for subsidized early childhood education, because it flows to individual vendors primarily. Are we using all that money effectively? Are we using all the money that's available? Are we maximizing the resources? Is it in the communities that have the highest need? Is it targeted to the age groups and the family need criteria where we would most want it targeted? So what we're doing is a comprehensive financial landscape analysis of all the money for subsidized early childhood education that flows into Los Angeles County. We will have financial models of how childcare providers blend together those multiple funding streams and what they need in order to do that blending more effectively. And we're also going to have highlights of innovation. There's innovative work going on all over the county in terms of blending municipal dollars, school dollars, healthcare dollars, mental health dollars, other dollars with those existing designated childcare dollars. Where are we doing that successfully? Where are we leveraging? And what can we learn from that? So that project's underway. We'll have some results at the end of June. We have an estimate already that we think that at least from California sources, $1.5 billion flows into LA County every year to support subsidized early childhood education. It's not an inconsequential number, and we have a responsibility to think about how we use those resources as effectively as possible. So I'm going to turn to Linda Aragon, who is, I'll probably give her a promotion because I think she needs a promotion, is the head of everything wonderful about maternal, child, and adolescent health at our County Department of Public Health.
Thank you. And I apologize, but I'm actually going to stand at the podium because my back is hurting me, so can't do it up there. So thank you. I wanted just to give an overview of the work that we're doing in our home visiting. It is farther along. We've had home visiting services in LA County for a very long time, but what was missing in that was really a system of home visiting. So we did, like I said, we did have this level of home visiting, but in 2016, our Board of Supervisors introduced a motion that directed our County Department of Public Health, which is me, to work with other county departments, First 5 LA, and several partners to develop a county-wide plan to coordinate, enhance, expand, and advocate for high-quality home visiting programs in Los Angeles County. And specifically, the board requested that we develop this comprehensive home visiting plan to include these 6 elements. They wanted recommendations for creating a coordinated system of home visiting programs in Los Angeles County. They wanted an assessment of national models and gaps, national models and best practices. They wanted identification of gaps in services and our strategies for addressing those gaps. They wanted recommendations for increasing access to home visiting services for high-risk families that we've been talking about. They wanted recommendations for collection, sharing, data collection, sharing, and analysis. And they wanted a framework for us to maximize resources that are existing resources and identify new resources to support the expansion and sustainability of home visiting. So this was no small task, but, going backwards, okay. This was no small task, but it was very doable for us, especially given our partners that were named in the board motion that are listed on this slide here, as well as others who have come forward since that time who have either a connection, investment, or an interest in home visiting services. So the plan that we submitted to the board last July, it really represents the culmination of all of our best thinking, our hard work, and highlights some of the work that was already underway and that we have been since we submitted the plan that are continuing to unfold. So that was our plan. I just want to show that. And if folks are interested, it's actually a really great plan. It really lays out what we need to do and where we're going with home visiting. So it's on our Department of Public Health's website, and we can make it available to folks as well. But as we were developing this plan, I keep going backwards, sorry. As we were developing this plan, our leaders, the leadership in our county departments came together and they decided to develop a vision statement and guiding principles to not only serve as the foundation for interdepartmental and cross-collaboration around home visiting, but to also guide us in our ongoing efforts to expand home visiting resources in LA County, because we knew that this plan is not just going to just be put together and lay on a shelf, but actually we're going to implement it, and that's what we've been doing. But fundamental to this vision is the recognition that home visiting plays a specific role in supporting families and must be aligned with our other investments, including our own department's county health equity initiatives, our work around Help Me Grow, which is developmental screening for delays, early care and education that Jacquelyn touched on, our prevention plan, and also the Department of Children and Family Services Prevention and Aftercare Networks. So the plan, there are 4 key areas in the plan that, for system change that we believe are critical when we consider the strategies for making home visiting more accessible to our families. The first is coordination. We need to ensure that we have a coordinated system that expectant and parenting families, as well as our providers, can easily access, and that the coordinated system provides the right combination and intensity of services to best fit the needs of our families. There's 3 strategies that emerged from our plan that we feel are most valuable for improving access include building a coordinated referral infrastructure that includes centralized technology, increasing pathways from county programs into home visiting and community supports to better meet the needs of the high-risk populations, and embedding universal prenatal and postpartum screening and access to home visiting within primary health care systems where we're leveraging and building upon existing health support. Second, we need, as we expand home visiting services, to accommodate more families, and it's important that we have a highly trained and qualified workforce. And this is something that we're really grappling with, because as more funds are coming in, what we're finding is that we have to build the workforce to meet these needs. So, and not only just getting more, but a more qualified workforce. So to meet this need, we're pursuing several workforce investment opportunities, which include increasing perinatal mental health, cross-training and clinical support, increasing cross-cultural humility and reducing implicit bias. We're looking at recruitment strategies for adding home visitors that mirror the diversity of families we serve, and conducting a workforce study that looks at compensation for home visitors, as well as educational and professional development pathways to grow the home visiting workforce. The third area that that's critical in our plan is data collection, which we're going to obviously been talking a lot about. It's the data collection, analysis, and reporting on home visiting for the purpose of performance measurement, continuous quality improvement, and capacity building, and resource planning. Some of the elements we found that related to each of these purposes are already in place in both program levels and at our countywide collaborative level, and that we envision that as we're moving forward, that our countywide home visiting system will build on these existing data systems and align our data collection efforts so that we're all really better able to tell the LA County home visiting story of how we're contributing to birth outcomes, increasing child safety, building stronger families, and tracking cost savings and avoidance. One thing that I found that when I came into this is that LA County, we do a lot of great work, but we haven't been able to really tell that home visiting story, and our voice is missing at the state and national level. And with the effort that we're working on now, that we're going to be part of that, really more meaningfully part of that conversation. So we're excited about that. And the fourth key area that in our plan for improving our systems is identifying opportunities for maximizing existing funding resources and identifying new revenue streams to support home visiting expansion. So not surprisingly, when we compared our capacity of home visiting services to the community needs, we found that we really don't currently have the resources to meet all of the needs for the most intensive cases that we need to serve, intensive families, as well as the more universal services to the general population. And so as we were doing this, part of the calculations that our Children's Data Network and First 5 LA showed us is that we currently have resources to provide services to about a third of the most intensive families that need services. So we're missing 2/3 of those intensive services for those high-risk families. And then if we just wanted to talk about general universal home visiting for that anybody has access to home visiting, we currently have the capacity to serve about 12% of our population. So obviously we need to have more funding and more resources to increase those, the amount of services that we're able to provide families. So that was our home visiting, our elements of our home visiting. When we were developing this plan, one of the things that became some key themes emerged for us, and it became very clear that home visiting must prioritize women at risk for poor birth health outcomes and families at risk for abuse and neglect, as these are challenges that put children at fundamental risk of not being prepared to be successful in school and life, right? We know this. In addition, we recognize and acknowledge that home visiting is a critical component to a system of care. It's not the whole system of care, but we're part of a system of care. And then we also recognize that the traditional, or what we know as evidence-based home visiting programs, will not work for all families. And we really get to be intentional at how we can best support high-risk women and families with high needs that may be too intense and too life disrupting for typical home visiting programs to adequately address. And so that what really translates is to, we have evidence-based home visiting programs, but we also get to be innovative and creative in identifying additional home visiting that supports our most critical families in need. And finally, because home visiting impacts multiple child and family outcome domains and associated sectors and systems, we must garner resources from across these areas, not only to fund, but to sustain our support systems. And so I'm happy to report, as Jacquelyn said, we've actually made some progress on the implementation of our comprehensive plan, and I'm going to share those with you now. So, since we submitted our report last July, the Department of Public Health, First 5 LA, and many of our partners have already begun implementing recommendations outlined in the plan. And the next couple of slides just highlight this. One of the things we want to highlight is the Department of Mental Health has made a significant contribution of $40 million to the expansion of home visiting in our county. Their most recent investment has allowed us to geographically expand 3 evidence-based home visiting programs into every single SPA, or service planning area, where they weren't before. So now we have Nurse Family Partnership, which is an intensive home visiting model, as well as Healthy Families America and Parents as Teachers in every single geographic location for our families. And thanks to, so that's 1. 2, thanks to the tremendous efforts of our partners at First 5 and our other key partners, for the first time, our California budget redirected our TANF funding, or CalWorks funding, to home visiting services. And it brought in about $22 million for Los Angeles County alone for over the next 2 years. And we just finalized our memorandum of understanding with the Department of Public Social Services to receive that funding, and we're going to begin providing services to first-time pregnant and/or parenting CalWorks clients starting on Monday. So we're really excited about that. That's happening. Thank you. I got one. Thank you. And then another another area that we're really excited about is our Substance Abuse Prevention and Control Program division in our public health has allocated funding to pilot a new model of home visiting for women that are high risk to substance abuse, homelessness, or mental illness. And so we're rolling out this pilot, which is, it's not evidence-based, but it's innovation and creativity for providing, and so we're going to be rolling out this home visiting pilot project in the summer, where we're going to serve starting with 150 women from preconception through parenting in the first year. And so we hope, as we collect data around that, we'll be able to expand on that as well. So, where are we now? and our next steps. So we're continuing our efforts to expand system capacity through DMH and CalWORKS funding, and we're looking for other resources for funding home visiting services that will allow us to continue toward a system that provides access to all appropriate level of home visiting services for families in Los Angeles County. Another current effort is we just created our home visiting leadership collaborative that is responsible for ongoing system coordination, quality improvement efforts. And we had our first meeting in February, and we'll be rolling this out, and we're meeting quarterly. This is where we're going to continue to look at our plan, look at our collaboration efforts, look at our funding, look at all of our 4 domain areas of our data, coordination, workforce, and identify opportunities that were for us to dig deeper, go deeper into the work that we're doing, and provide the oversight to make sure that we're on track for meeting our recommendations that we put out in the plan. And then finally, with our collaboration with the LA County Perinatal and Early Childhood Home Visitation Consortium and philanthropic partners, we've developed, and we're in the process of developing an electronic referral system that will be in place by the end of this year, and that we will be working where families and providers will not only have resources at their fingertips where they'll be able to go in online and identify home visiting services that meet their needs in their geographic locations, but also meet other needs, because the families that we're serving in home visiting are also the families that need early care and education, that they also need developmental screening resources. And so we're developing this more comprehensive electronic referral system that will combine all of these services in one place so that families can go to one place to get the services that they need. So those are some of the work that we're doing around home visiting. I really appreciate the opportunity to be here and share this with you, and thank you very much.
Regan Foust, who's the Children's Data Network Director of Strategic Partnerships, to share an innovative data tool that we've come up with that's sort of framed more around this early look at supporting families, and take it away.
So I'm Regan Foust. I'm the Director of Strategic Partnerships for the Children's Data Network here at USC. On behalf of my colleagues there and Jacquelyn McCroskey and Lee Putnam-Hornstein, I'm excited to tell you a little bit about our work, as well as highlight one project, the California Strong Start Index, that is a way that we're using data to help identify communities that might benefit most from additional services and supports. So here, let me tell you about the Children's Data Network. So originally the brainchild of First 5 LA and that humble fellow sitting right over there, and now supported by a variety of other generous funders. The Children's Data Network is a data and research collaborative that specializes in the linkage and analysis of administrative records. And specifically to inform children's programs and policies.
Children's experiences and environments between birth and age 5 are foundational to later good health, educational attainment, and overall well-being. At the Children's Data Network, we believe that by making better and smarter use of available data, we can ensure that more children grow up with the foundations needed for success. Throughout the life course, individuals generate data in the form of various records and documentation. When a child is born, health and demographic information is recorded. If that child is later referred for a developmental evaluation or receives early intervention services, other records are created. These records, called administrative data, are collected through distinct systems under the authority of different public agencies. The siloed nature of administrative data has long posed problems for policymakers, managers, and researchers. Information from a single agency provides a very partial picture of children's trajectories through systems over time. It cannot be used to determine the number of children concurrently served by 2 or more agencies, and it limits the identification of antecedent events captured in one data system that predict later outcomes observed in another. It is through a process called record linkage that information for the same individual can be integrated and used for research and evaluation. After records have been securely linked and anonymized to protect confidentiality, these data can be aggregated to generate rich epidemiologic information and answer important questions. Are nutritional supports during the first 5 years of life tied to later educational performance? Do children in foster care have unique health and mental health service trajectories? Does the receipt of early home visiting services lower a child's risk of abuse or neglect? Developing high-quality evidence for program and policy effectiveness is a strategy worth investing in for the long term. By making use of administrative records, the Children's Data Network can help us understand what makes our children, our families, and our communities healthier, safer, stronger.
So I would urge you to go onto the Children's Data Network site and view the animation and others for yourself. There are a few others there that are equally compelling. In essence, you could think of the Children's Data Network and the work that we do as a large-scale, longitudinal birth cohort project. So we start with birth records, and we're able to drop in existing records for those same children. And when arranged chronologically, you can start to better understand the health, well-being, public service interactions, and ultimately the outcomes for those children. I am here to tell you today that birth records are really cool. And yes, I'm a nerd, but I also think that you'll agree when I am able to explain all the things that we can do with just birth records. So birth records are collected on every single child who's born, so it's universal. And it can provide a population base for looking forward, so prospective analyses. It's the first data that's collected about an individual, and all of the records are standard, so across children and across time, which makes it really great for research purposes. And there's a lot of information in there. So in addition to health and information about the services that were offered to the mother, there's information about other sociodemographic indicators that are really important when trying to understand risk, resilience, and outcomes. And importantly, it includes information for 3 individuals. So not just the infant, but also his or her parents. So when you pull all of that together, and then you visualize it, what you get is really a snapshot of the conditions into which children are being born in California in a variety of communities. And also, which communities might need more support so that the children there can grow up on equal footing. So those are the goals and the genesis of the Strong Start Index. So in partnership with First 5 Association, First 5 LA, and other First 5 commissions, we created an index from 12 indicators available on the birth record, and specifically those that have been shown to be related to good outcomes for children along the life course. So we counted up those assets, 0 through 12, and gave each birth a score. We then geocoded them and aggregated them up to the census tract neighborhood level, and then we mapped them across California. So the Strong Start Index, as you can see here, essentially summarizes the conditions into which children are being born. And when visualized as a map, and I urge you to check this out, it's at StrongStartIndex.org, and the disparities across communities are made more apparent, you can really understand how it would be an important tool for policymakers to understand where they might want to target their resources, where they're needed most. Now, this is great for those who are working on behalf of young children, because the data is very specific to the population of interest, right? It's babies who were just born and where their families live. The data is really local, but it's also can be used at a statewide level in order to compare communities. And it also can be disaggregated on some of those sociodemographic factors in order to assess disparities or inequities. And importantly, the data is at an individual level. So rather than combining discrete data sets at a community level, or surveying samples and collecting new information, and then generalizing that information up to a population level, you're actually able to see a more holistic view of the resources, the constellation of resources that are available to individual children and families that live in those communities. And then, what's awesome is that you're able then to link those kids' records to their records that exist down the line for them in order to actually assess if those scores related to better or worse outcomes for those children. So with the Strong Start Index, we linked Strong Start Index scores to child protection records and death records and found a strong inverse relationship between Strong Start scores and those two outcomes for children. So now viewed in the context of the prevention efforts that are being described today, the Strong Start Index is a unique tool and one of many, right? But it's unique in that it can help policymakers understand strengths from the earliest points in time, inform program planning, and then also support more equitable investments in communities and families. So take home visiting as an example. Because the index is based on actual birth records, you can start to use it to estimate the number of slots that you might need for a particular year for a home visiting, a universal home visiting offering. But also because the scores are continuous, where high scores are related to higher levels of resources and a less strong relationship with some of those adverse outcomes that home visiting is aiming to prevent, that those children in those communities might be a better match for a low-intensity home visiting program, whereas lower scores signal fewer resources and are stronger relationship to some of those adverse outcomes that a high-intensity home visiting program would be more appropriate for. So you can start to align needs and services and estimate the number of slots that would be needed for each type of service, as well as where they should be located in order to best support families. So effectively, it can be used to build out a home visiting service system that is universal but also tailored. So the Strong Start Index is just one of our projects at the Children's Data Network. So feel free, I would love to speak with you about our other work, but I'm just so excited to be able to bring this work to you and explore other opportunities that we can leverage data to support families. Thanks.
I told Armando he had to finish us off with, and I know he can do it. He's the, I'll give him a big promotion too. He's the director of everything research and data at First 5 LA, the godfather of the Children's Data Network, but also the person who's leading our work with this prevention project on metrics, data, and how are we going to measure outcomes of all this effort?
I like being referred to as the godfather. It has a certain mystique to it, right? Like,
yeah.
So how many of you out there know what First 5 LA is? Oh, good. I don't have to really spend too much time explaining our origins and how we got started, but we're a very interesting organization in that we target a population 0 to 5 using tobacco tax money, which has presented an interesting problem for us because since we started, people are smoking less. It's a good thing. Thank you, Linda, for your public health masterful work, but it also is our revenue, and that's what we use to do the work that we do. Over the past 20 years, in fact, we just celebrated our 20-year anniversary, which is pretty phenomenal to think about that. To me, it's gone by just like that. But we've learned so much, and one of the things for me that I think hits home is just how fundamental and important it is to have a strong, nurturing relationship between the child and the caregiver, whether it's a parent or it's another caregiver, how important that connection is. And I think sometimes I try to refrain from turning on the news because we see glimpses of situations where children are being separated from their families. They're being placed in kind of iron or steel cages. Understanding that the fundamental need for these children to be with their parents is so paramount to their long-term trajectories and their outcomes. So it's a really interesting and unfortunate contrast that we experience today. But what I want to say is, however depressing and discouraging it is to see that, I just want to motion over here to my left, and these 4 individuals, and just the tremendous work that they're doing restores hope for me that we have a chance here in LA County, and hopefully nationally, the statewide and nationally. I wake up every morning and I try not to turn on the news, but at least when I get to work and I get a chance to work with these individuals, I really get enthusiastic and hopeful. I'm gonna talk a little bit, just very briefly, about what I say past, present, and future. When I started at the commission, one of the things I realized is how little we know and how little I knew about children 0 to 5 in LA County. There isn't much information that I was able to use to help us determine kind of what do we do? How do we make use of this tremendous resource and these dollars that we have? But one of the things that's very interesting about this discussion is seeing the maps and seeing the differences, at least the data provides and presents. When we first started our work, one of the things that we were very interested in is we wanted to think about, well, is there a way for us to invest in places, communities? We identified an initiative called Best Start, where we identify 14 different communities throughout Los Angeles. I think one of the most critical things for me during that early process was we chartered a bus. And we got, several of the staff members got in the bus and we drove to these 14 communities. And I know many of you who get on the freeway, you're driving along the parking lot of the 405, 110, whatever parking lot it is. But oftentimes you're going from one place to the next, not really paying attention to what exists on the side. Going on those buses, one of the astonishing things was to see those neighborhoods. When you talk about the neighborhoods that have the high levels of poverty, the low infrastructure, to see them and to go and to walk around and to talk to people in those neighborhoods, all the way from Long Beach to the Antelope Valley. To me, one of the things that I found very hopeful was that the one thing that was the same across all of these communities when we talked to parents and providers is the amount of desire that these folks had to make their children's lives better. There was no difference. There was a difference in infrastructure, there was a difference in participation of providers, but there was no difference in desire to make their children's lives better. So I found that very inspirational and also, very kind of motivated to see if we could make a difference in these places. The other thing we did is we had a chance to talk to some of the parents who go to what we call Best Start meetings. We try to have parents engaged in the process of changing their communities. And in one of the meetings, we encountered a woman who, we asked them, okay, why do you come to these meetings? What is it about this work that you want to contribute to? And she was very, very shy, very, very timid. And she just started to say, well, I came to this meeting because my son has issues. And so we asked, well, what kind of issues? And she started to describe the classic symptoms of autism that was manifesting in her son. And she came to the meeting because she needed help. I don't know what to do for my son. So I found out right away that she had this desire to come together to understand what she could do with her son. And she realized that that particular meeting was not the place that she would get help, but what she did get was information about what was wrong with her child. Over the course of the conversation, she became more and more animated because she realized that her participation in that meeting, in that work, was an opportunity to give voice to what was happening with her child. And also to be, to kind of hold up a mirror to how disconnected the systems are that are supposed to be in place to serve her child. From the very beginning, she thought for so many years that it was her fault that her child was autistic. She had so many struggles trying to figure out not only what was wrong with him, but where to go. So in the course of her participation, she became an advocate. And she gave voice to her child. So in many ways, data and what we see out here are small voices that give kind of a sense of what's happening and what's going on. And so we've, at First 5 LA, have worked to try to figure out how we can give voice to all of these issues through our data work. We've had several partnerships, and I wanted to acknowledge a couple. Gary Painter, sitting here, we invited him to be a part of a thing we called our Research Advisory Committee. And he so gracefully and willfully said, just tell me what I can do to help, to provide some wisdom and thinking about how we might want to organize some of our research work moving forward. And I have to say that we always go to those notes to help us remember some of the wisdom that we got from some of those meetings. And they helped us understand a lot about some of our investments, how we can make better use of them, how we can do better research, how we can use data more effectively. I also want to kind of give a shout out to another person. I know I saw him here, Dal Myers, who's back there, who we asked him to help us think about what does the future look like with regard to kids. As a demographer, he gave us some really interesting and wonderful wisdom around the whole idea that what's happening in this, not only nationally, state, but in the county, is that birth rates are declining pretty rapidly. Also, kids have left LA. And so what you have is you have more kids, or you have kids who over time will shoulder a greater responsibility to the kind of the social burden. So I wanted to really thank him for kind of opening our eyes to that and understanding what that means. But when I talk about the future, I wanted to say that we are in a very, I think, wonderful time. The governor, the state of California, has really committed to early childhood development, has committed to investing money in this work. There are revenue streams, as Linda and Carrie have mentioned, that are unprecedented around prevention. So really, it's an opportunity for us to make best use of that and to benefit from that. I'm often asked in the work, and some of our folks would ask me, okay, what's the return on investment on these investments in early childhood? And that's a legitimate question, and I'm always very thankful that we have an opportunity to try to answer it with data. But I also, on the other hand, say, well, that is an important question, but shouldn't we be doing this because it's the right thing to do? And I do think that we use this data, and we want to have this data be able to challenge ourselves as organizations that provide supports and services to children, that we should do a better job. We should get better outcomes, and we should be better at providing and connecting systems for children and families in LA County. So I really thank you very much, and I also wanted to put a plug in. If any of you are students, postdocs, or individuals that are looking for the future in terms of your career, First 5 LA is hiring. So I really wanted to thank you for giving us an opportunity to share. And I wanted to say how important it is in this particular day to include early childhood and children in this conversation. We're often left on the sidelines. We're often trying to get a seat at the table, but thank you so much for inviting us, and my wonderful colleagues here for kind of making all this look wonderful, and it is wonderful.
Hi, my name is Leticia Chacon, and I'm the CEO of Human Services Association. And I started working in the county in 1974 with the it's really 84, no, 74.
Yeah, exactly.
It's the 84 times now. With the county health department in the east side, it was a Roybal Comprehensive Health Center, with maternity and infant care project. It was coming out of the Adolescent and Health Department many years ago. And I believe truly that that is one of the most powerful programs, because you don't only see the child, you get to see the mother and the parents when they're pregnant. And that's when they're most vulnerable and most open for suggestions and support. And then it was a whole team, the doctors, the public health nurses with home visits, counselors, case managers, the gamut. We had groups, for the women. We had, education on nutrition, and, we dealt with domestic violence and everything from the get-go. So I really, really hope, and I keep wishing for something like that to happen again, because was a very powerful. We also reduced some weight, what do you call that, where the babies are really very underweight. So we improved that as well. So it's a great program. I'd love to talk to you, Linda, a little bit more about that. Thank you.
Absolutely.
Do you want to respond to that, Linda? Or
it's kind of interesting because I've been in I've been in the Department of Public Health for 28 years. I've been in maternal child adolescent health for only about 3.5 years now, or 3 years now. And in looking at the history, there were a lot of really amazing programs that, as we all know, probably through funding cuts or whatever, were eliminated. And it's kind of interesting dynamic as we're going back to this and looking at this comprehensive, coordinated system of care. We're looking at the same things that we were providing. And so it's kind of like we're coming full circle back to this. And so we have the opportunity to look at our healthcare systems, our medical hubs, our comprehensive perinatal services program, and also our other county programs, is how we can better be connected better to home visiting. So that, because in the past, families would get a call from a public health nurse after delivery to see how they're doing. We don't do that anymore. Why aren't we doing that? Let's go back to that. So we are looking, at the things that we used to do well and seeing about how we can reinstitute it, and then also just expanding, who has connections to home visiting. Because it's not just the healthcare system, but it's all of it. It's our community-based organizations, it's our health plans, it's all of it. So we're looking at connecting all of them. So, yeah. But yes, let's definitely.
In terms of data, I was wondering about, as I was listening to this whole thing, there's a lot of data about persons and communities and groups where the outcomes are not ideal. And I was wondering what the data shows about the persons and communities and groups where the outcomes are a little bit more positive, not necessarily ideal. How is it that the resources and everything that is needed for such positive outcomes are concentrated towards those people and in those areas? And so I'm wondering what kind of focus has been on that side of things to see, excuse me, how the flow of resources has impacted outcomes in those areas.
Very complicated question. I'm glad we have at least 18 minutes to I'm going to take a first pass at it and then ask others to jump in. But one of the things that happens is that we always talk about our silos, and we have silos in terms of systems, but we also have silos in terms of programs. So even within a particular agency, you don't necessarily have, as the question before was suggesting, we don't tie together all the things that might be needed to really make a substantial success for that family. And each of those funding streams are allocated separately, most of them based on need. So what you see when you map almost any service in LA County, probably in any jurisdiction, any place, family-oriented service, not universal necessarily service, is strange gaps and strange overlap. So Linda can probably talk about home visiting. I can talk about early childhood education a little bit. So if individual providers apply for dollars for a particular kind of subsidized child care program, and they each demonstrate the need in the zip codes or the census tracts that they serve, and then a panel at the state or at the federal level decides where, but both who the provider is and are they capable of high quality service, as well as does the jurisdiction you're serving meet service needs, what you end up with is patchwork. You end up with some places who are really good at working that system and have great capacity. And I'm going to say HSA is one of the nonprofit agencies that is an example. We have fabulous nonprofit agencies in Los Angeles County who are really good at keeping funding flowing from multiple funding streams, and then they connect it together at the community level. But that's not the case in all communities. And it's particularly not the case in the communities that have the fewest resources. And by that I mean both not-for-profit agencies, high-functioning schools, employment opportunities, et cetera. So you've got this funny siloed system where we know families are going to need more than one thing, and we allocate the money just based on the need for one thing. In the communities where the families need the most, they're least likely to be able to put together the pieces that will actually support families successfully. So please feel free to add if you want.
I mean, and I think it's the same historically for home visiting, right? So it's very siloed. It was really looking at just home visiting services. And what is changing though is that what I've talked about earlier is now we're looking at home visiting, you know, like what I said is like the families that need home visiting services also need the other services. And so rather than being siloed, especially in the Department of Public Health and our health agency with our Department of Health Service and Mental Health, is like how can we serve all of these families and get all of the resources there? So I think it's almost unprecedented that when this board motion happened in 2016, it really brought together our three departments to really look at the families that we're all serving and pulling our resources together so that they're not just connected to home visiting, but they're getting mental health services. They're also getting early care and education services. They're also getting developmental delay screenings and services. So we're trying to come together and break those silos and come together as a real system of care that we've talked about that is addressing all of their needs. Unfortunately though, you know, there's more need than resources, right? I mean, even though we're expanding home visiting services into all of the spas, our service planning areas, they're big spaces. LA County is a big county. So even though we have, you know, 3 agencies, are we still in enough area to get those families in that spa to get to that service? Because it's such a big space. So we have to look at opportunities for expanding it to make sure that all of the areas in the spas, all the families in the spas are getting the services. Because even though, like I said, is like we're saying, yeah, we're in spa too, we have, you know, all of these agencies that are providing the services, but spa too, you know, like they're all clustered in one spot. Try to get a family or a new parent, you know, with an infant on a bus or some way to get down here, it's very difficult. So we have to look at how we can really expand those services to all of that whole area. So like I said, for the first time, our departments are really working together to look at that and to really get down deep into the communities that have the greatest needs.
One other piece of this I just want to mention is in the Health and Human Services, which is what we're talking about trying to knit together. This is voluntary. These are not universal systems. These are not funded to be universal systems. We don't have the resource allocation to make them universal yet in most of these areas, and families have to choose and should choose. This is what I want, and this is who I want it from. And so the issue of engaging families and building trusting relationships with families in communities, in local areas, is huge. Because it's not like the school system, for example, when we're assuming that every child is going to go to school and it's a matter of figuring out which one, right? Families, particularly when their children are young, particularly when there's a problem or an issue, the story Armando told, the story of my family, so many families we talk to, families aren't going to trust a sign on the street that says, come in here and we'll help you with fill in the blank. They really need to know somebody in their neighborhood, somebody they know, a family member has been there and says, you can go to this place. And so that adds a whole nother dynamic to the issue.
So as a person who grew up in foster care and aged out of the system, I would argue that choice may not be a real thing. But I will ask, how much of this data is forward-facing? How much data is shared with these agencies? Can they edit data, ask for more data points, and more service areas and expansion? How much is inclusive with the agencies that you work with?
So you're absolutely right. Foster care is not a choice of the youth or the family most of the time. But many of these supportive services are in the realm of choice. And so at the Children's Data Network, one of our basic premises is that we are working with the agencies that are on the front lines of working with families and providing these services and helping them to answer their questions. So we view it as a partnership where we're able to add some expertise and some analytic capacity to help the agencies who've actually got the frontline responsibility prioritize which questions are most important when, which geographic areas, and how they want to, what they want to know and when they need to know it. So if we want data to be used for systems change, then the primary partners have got to be the people who have the ability to actually do that systems change work. And anybody else, Armando, Regan, anybody you want to add?
I just wanted to say that we as a funder need to be more conscious of having community-based organizations have the capacity to collect their own data and use their own data, and for us to be able to invest in organizations' ability to make meaning, right? To use it to make decisions, to make better decisions for their clients. That's one thing that I think is important for us is moving forward, thinking about how to do that. The second is sharing data, how we can promote data availability in things like open data portals. Carrie mentioned the county's work in providing open data portals for the very reason for us to be able to make sure that community-based agencies are looking at their particular worlds in their areas, in their communities. The other thing is to circle back with agencies to ask the question, is this useful? Is it helping? Is it something that's providing you with information that's making you a better agency? I think we need to be better at circling back and asking those questions.
Hi, I'm Marianne Haverhill, Executive Director of Propel LA, which is the implementation of our countywide strategic plan. And we actually have strategies around early childhood, around helping families in crisis, i.e. through home visiting, as well as in mental and physical health. So I have 3 questions about mental health. One is that, I would just love to know if this is true or not, but what I've heard is that in this home visiting process, there's been the discovery that there's many more mental health issues than previously workers supposed that there might be. Just wondering if that's true. Secondly, I talked to a leader in the mental health space a while back, and I don't know if this is still true or not, but her concern was that when a worker would go out and visit a family, if they identified a mental health problem, that the family member or members had to go to a mental health office rather than sending a mental health worker to the home, where the worker could then assess whether there's a larger issue of mental health rather than just the one family member. So I'm wondering if that has been changed, or maybe, whatever. And the third thing has to do with workforce. finally, in recent years, mental health has come into the larger consciousness of something that we really need to face and work through. And so I'm just wondering, given all the demand, whether it's schools or universities or public agencies or nonprofits, how are we doing in terms of enough mental health workers to fill the demand that's out there?
So, and you're absolutely right. What we were finding, when we used to define high-risk families, it literally used to be you were a pregnant teenager, right? That was high risk. What our Nurse Family Partnership is an intensive home visiting, and what we're finding is the level of issues run very deep. Mental health is one of them. We do have, in our Nurse Family Partnership, we have 2 licensed clinical social workers who actually get referrals from our nurses to go and do home visiting with the families. We're also working with the Department of Mental Health to identify additional licensed clinical social workers that will, to build that up to go into the homes. Because like I said before, trying to get someone who has a new baby to get to a mental health facility, who then has to wait an hour or 2 hours to get their appointment, is not ideal, and we recognize that. And so we're working very closely with our Department of Mental Health to look at how we can provide mental health services in the community. So we're working towards that. We're not there yet, but we definitely recognize that definitely is a need. And the number of issues that families are dealing with, it's tremendous. And for us to expect them to then pick up and go is not reasonable. So we are definitely trying to get the mental health services into the communities for them.
Just to give a plug for mental health, our mental health partners are not with us today, but the Mental Health Services Act funds counties to deliver a broad range of mental health services, and our relatively new Director of Mental Health, Jonathan Sheeran in LA County, fabulous, focusing on prevention and early intervention and different ways of embedding mental health practitioners, but also assessments and training for all kinds of practitioners in child care centers, consultation for child care providers, in home visiting programs, in DCFS offices, in Department of Public Social Service offices. It's a whole new era. We're not there yet, but it's definitely very much on the forefront of what's going on. So I appreciate the signals, yes, that we're at the end of our time. Join me in thanking our panel again.
Let me also offer my own gratitude toward the panel. I'm also going to announce a break in just a moment, so you'll be thanking me for that as well. I really just thought, just a couple of personal reflections. I really appreciated Armando noting the little voices that data can bring. But I think the point there is that data as a little voice is not necessarily privileged more than other information and evidence that comes from communities. And I thought he articulated that quite strongly. They're complementary. They're not definitive in that conversation about what's happening in communities. I really appreciated that a lot. I also really appreciated thinking hard about the diffusion strategies to see impact and to achieve the goal of having healthy, stable, and thriving families at early ages. And you saw that the work that's been happening in the county is both innovative and transformative, but certainly has to be informed by those goals in ways that we'll take time to kind of coordinate all of those who might be working in these spaces to make sure that you're weighing in on what that might mean and how that connects. And I think it's also important to recognize in some sense, and I think Armando said this as well, like that this first 5 area has been incredibly siloed from these other spaces that a lot of us might be working in education and in working on justice-involved careers and those kinds of things. Yet, they're absolutely foundational and essential to bridge those gaps. And so we perhaps don't yet know what are those connective tissues that need to be there. And maybe that's the space for social innovation here, is making and building, again, forging those new pathways. So as we move to a short break, we'll be reconvening at 11:30. You'll be receiving a worksheet on your table, which you can do at the beginning or end of the break. It's up to you. And we want you to continue to organize your thoughts around how you define opportunity, what you see as barriers to opportunity, and what you see as possible solutions. You don't have to fill it all out during this break. You can do it at lunch, you can do it after, but we're going to collect these at the end of the day. And as I mentioned, we're going to kind of capture the collective insights of everyone here at the conference and then publish those back to you. I noticed not everybody is tweeting, so some of you like old technology, here it is. You know, you pen and paper, and we're happy to also get your insights that way as well. So I look forward to reconvening at a fireside chat with David Plouffe, who is the head of policy and advocacy for the Chan Zucker Initiative at 11:30.